Welcome to today's podcast. My name is Pearlie Brewer, and I will be your host. Today's podcast guest is David Comeau from RelyOn Nutec, Canada. Today we're going to talk about rescue plans for fall protection and confined space work. Welcome, David.
Thanks, Pearlie. Thanks for having me on.
Normally we do not do podcasts with individual businesses as such, as we really don't want to be seen as promoting any individual companies. But today we're making an exception. During the last decade, as I did training around the province, I encountered numerous organizations who had no rescue plans when they did work either at heights or in confined spaces. Their rescue plans was, we'll call 911. Today we're going to talk to David about these topics and try and get some information out there on what companies should have in place when it comes to rescue. David, let's start by getting you to talk to us a little bit about your company, RelyOn Nutec Canada, and what your company actually does.
Sure. Thanks, Pearlie. Well, RelyOn Nutec Canada, we just went through a name change about 4 years ago. Some folks might recall us being Falk Safety Services. Both of these companies are somewhat new to Canada. They're very large in Europe. So we have local Canadian shareholders here, and we have partnered with RelyOn Nutec, which is probably the largest provider of offshore safety and survival training, very big in energy, in wind, that kind of thing. RelyOn Nutec Canada, specifically, we do all the offshore training for the fellows that work offshore Newfoundland. We have a training center in St. John's, one in Dartmouth. Folks that have seen the helicopter going upside down, that's us. We also provide this to the military and to the feds as well. And we also do industrial work. So started in probably my involvement in confined space probably came in 1991. We offer entrant attendant basic fall protection training for workers, but we also do rescue training as well. And in addition to that, we provide rescue standby services. So for companies that require maybe just a rescue team for a short 3 or 4 hour job, we provide that as well, and air rentals and that kind of thing.
So let's start with the topic of working at heights. You receive a call from a company, says that they do work for a variety of industrial clients around the province. The work may be done anywhere from 15 feet to 100 feet above the ground. And they ask you basically, they want some advice on what should be in place when it comes to policy, procedure, what type of training should they provide to their staff to ensure that they're properly trained, and what should their actual rescue plan look like. So it's a pretty broad topic, but just I think to walk us through what you would say to a client like that to ensure they have an appreciation.
Sure. When a company is involved in working at heights activities, what we typically tell them to do or encourage them to do is to try to put together a working at heights program. So a working at heights program involves a number of things. First is buy-in from leadership. So we recommend that not just the workers doing the work, but the people who are supervising them attend a fall protection course, because then you learn about stuff in fall protection. You learn about suspension and trauma, and you learn about fall factors and the different equipment that's available. That training in turn helps you form your policy, your procedures, your safe work practices. So, the workers, when they arrive at a site to do work at height, should have a clear understanding of what's expected of them. They should have a clear understanding of how they're going to integrate. Let's say they're doing work at another company site. You might come on to an Irving or a Michelin or some big company like that. Those companies are going to look to see that you have training, that you have the proper equipment, and that you've got some sort of rescue plan. Now, the rescue plan might fit into the group that you're working with. If you're on let's say, for example, you were doing some work at a base, a Canadian Forces base in Gagetown. You might say, what's the rescue? Do you guys have a rescue team? They might say, yeah, we do actually. And so we'll activate them or let them know that you're doing this work. There's also, a level of rescue, that we refer to as basic rescue. And that's something that two workers, one worker is able to rescue the other. So if you've ever seen, for example, on the back of New Brunswick Power, Nova Scotia Power, you see pole top rescue kit inside. That's that kind of thing. These are specialized units, very specific to task. So if a worker comes off of a height and is suspended or hanging in their harness, this is a way for their fellow worker to quickly rig up a quick system and lower them down to the ground or to a position of safety. As you get into more, more sort of sophisticated work areas or more challenging work sites where you're looking at rescue from high angle, then you're probably going to want to look at some sort of rescue team that has that kind of high angle rescue skills and equipment to do that.
So why is it so important to have a rescue plan?
Yeah, just for that if a worker is, using their fall protection, they're working safely, and then they fall or the system works, they have to be rescued in a timely manner. In the sense of fall protection, one of the things that you learn on a fall protection course is that prolonged suspension in a harness is not good for you. There's a bunch of medical things that occur around compression strapping around the femoral arteries where the fall protection full body harnesses go. There's a thing they call pre-syncope or pre-fainting, where you're essentially you want to faint, but you don't fall down. You continue to remain sort of hanging up. The head usually drops forward if you're unconscious. So timely rescue has to happen very quickly. I think as you guys have discovered, when you ask people, what's your rescue plan? They say, well, we'll phone 911. There are very few technical rescue, capability or teams in Atlantic Canada. Some of the bigger urban areas, St. John, Moncton, Halifax, St. John's, Newfoundland, they will have usually a small technical rescue team. But you got to remember the municipal fire departments, if you were to phone up the chief right now and say, let's talk about your training budget and what your plans are, there's a number of things that are pulling on them. There's technical rescue like high angle rescue. There's confined space rescue, trench rescue, swift water rescue. All of these things we phone 911 and we expect the fire people to come and do something, and they're really not set up for that. To do a confined space rescue, you need to have a proper equipment, you need to have supplied airlines, you need to have patient packaging, and you need to be trained to go in to do a confined space. A firefighter that shows up on a small rescue truck with turnout equipment and a breathing apparatus on his back is there to fight a fire. Expecting them to be able to come in and be able to do some sort of technical rescue is a little bit challenging. Sometimes you'll get places, work sites in more remote locations, the half of the volunteer fire department is already working at the plant. So a lot of those places will develop their own teams rather than depend on rescue teams. And it's happened. I had a guy in Sydney, Cape Breton years ago. And we were doing confined space, and I said, well, what's your rescue plan? He goes, well, we'll phone 911. And I said, well, let's give him a call right now. And, we phoned the fire department. They said, no way. We don't have gas detectors. We don't, the equipment that we need to do this, we don't have. So, confirming and verifying that you have a competent rescue team to be able to recover you is part and parcel of the safety management and the permit. When you fill out the permit to work at heights, there's a piece there that says, what's your rescue plan? If you fill out a permit for a confined space. And that rescue plan can be something you take with you, like a pole top rescue kit, or it's something that's a little bit more sophisticated, and requires the worker to be lowered down. It's not to say that you don't want to call 911. You do, because remember, 911 is not just fire. It's also police, and it's also medical paramedics. They are part of your rescue plan, but I guess the expectation that they'll have a technical rescue people when they show up is not usually borne out in there. And even in Halifax, that does have a technical rescue team. It's a big city, so they could be called down to the shipyards. They could be called to Burnside for an industrial accident. They're not guaranteed that they're going to be there. And so that's why having some sort of dedicated rescue team is pretty critical in that kind of work.
So a question that I often get is, someone's hanging from a harness. How long do they have? How long do you have to get a rescue?
Yeah, this is quite a, this falls under what they call suspension trauma, or pre-syncope, and a lot will depend on what the nature of the fall is. So let's take a worker that say falls, their fall arrest equipment works, they're suspended, they're swinging back and forth, and they're conscious. What we typically do is you can communicate with them, obviously. If rescue is required, ideally you'll get them to, a lot of the newer harnesses now have something called suspension straps. And they're a little add-on that you basically wrap, they're attached on the side of the legs. And in the event that you are suspended in a harness, you're going to be there for a few minutes. You can make a little loop with those things, and you can take some of the tension off the suspension straps on your legs. So that's a little bit more helpful. You can kind of move a little bit. The person can also report how they're feeling, some of the if they're getting lightheaded or dizzy or any of that kind of stuff. So that's kind of the easiest one to sort of try to recover. Somebody who's taken a fall, say a swing fall, and they are unconscious, or even worse, knocked unconscious. So they've taken some sort of blow, to the head or whatever. They're unconscious. That's a pretty serious medical emergency, and you really don't have a lot of time. You've got potentially airway issues. The way that harnesses are typically attached for fall arrest, you're attaching to the A connection point, which is in the middle of the upper back. And in a free fall situation, you're going to be hanging forward with your head down. That'll start to give you some airway problems. If there's any bleeding, or anything like that, internal or external, it's going to be a struggle to try to get that and treat it. So you could be looking at minutes to try to get someone down in a hurry. And that's not a time to, phone up a local volunteer fire department and get them to buzz all their members and get them to come down. By the time you get that, the worker, could very well be in a much more serious medical condition. We also know that prolonged suspension, unconscious suspension in straps is not good for blood circulation. There's a lot of work being done in this now, but the general thinking is 10 minutes of suspension is getting quite serious. And again, anybody who's been involved in any sort of prolonged suspension incident needs to go to a hospital and be seen by a physician with a bit of history, but not a lot of time, I guess, purely is if you got a worker that's up there going, oh my gosh, I fell, hey, help, and pick me up, that person can do some things to alleviate. We know that they're conscious. If they tell us they're not hurt, they're just swinging back and forth, and we can get working on that fall arrest rescue. It's the unconscious casualty. Those are the ones that are quite serious. And again, you're looking at minutes, to get them down, and, get the airway open, treat any deadly bleeding that's occurred, and deal with that harness suspension situation as well.
Yeah, and when you talk about 10 minutes, for example, 10, 12 minutes, whatever, boy, that goes by so quickly.
Oh, yeah.
And if you're thinking, 911, whatever, by the time you call them, by the time they respond, whether or not they have the staff that they do have trained. Yeah. Some will have specialized units, but you have no guarantee that the specialized units will be working that day, working that shift. Yeah. Then they've got to get in, and then it's not a practical solution in any format.
No, absolutely.
So what kind of equipment do you folks provide or encourage companies to have for different scenarios when it comes to rescue at height?
Sure. So when we look at rescue at height, there's a couple different ways to do this. One is, like I said, the fellow worker rescue, and these are typically kits that you can buy pre-assembled, so there's no knot tying or trying to figure out how to wrap the rope through. The kit comes out of the bag essentially ready to go. And these usually have an extension pole, so there's some way to reach the worker, whether it's from above or below. They all pretty much depend on having a viable anchor point above the worker, above where the worker's suspended. So again, just to sort of back up a little bit, when you've got a good fall protection safety program, your workers are trained, they have a permit to work at height, and they come in with a rescue plan. That's part and parcel of planning the job. So before anybody goes aloft, we take a look and say, okay, there's the anchor point. We'll anchor above the ladder above the worker if we have to use this stuff. Here it is. We'll take it out. We'll put it so it's nice and handy. We've all been trained on it, so everybody knows how it operates. And in the event that the fall occurs, then the second worker starts setting it up. Usually they try to climb a bit above the worker, hook up that anchor point, attach to their harness. And essentially what these things, there's an old saying in rescue, you go up with mechanical advantage, you go down with friction. So these systems have both. They have a little mechanical advantage that will actually lift the worker and their harness up, which what we call unweights the connection point, whether it's a self-retracting lifeline or a shock-absorbing lanyard. Then once the worker is unhooked, these systems allow friction to be able to lower the worker down to the ground. So again, it's a simple, typically, when working at heights, it's always better to go down, to the ground. That's where rescue is going to come and the medical people are going to arrive. So those are kits that you can buy. Rogueless, makes one. They're pretty big in that space. But there's other ones that you can buy, individual, folks sell them and again, they work fantastic. The trick to this is if as a supervisor or manager, if you do buy this kit for your workers, that they all know how to use it and that people are comfortable and can use it quick. It's easy to practice with a put a rescue dummy or even just a load hanging on the thing and practice getting it unhooked and lowering it down. So those are the fellow worker ones. For more sophisticated rescuers, you're looking at typically a high angle rescue team. And those are folks, they can be anywhere from, it could be as simple as 2 people, and it can be up to 4 or 5. But that's when a worker will basically climb up and attach the worker to themselves and lower the worker down. We used to call these a pick, where, you'd lower a fellow down or he'd climb up. And the worker unhooks the injured worker, from their system, brings them onto their rescue system, and then that person's lowered down. So that's going to involve things like rope. There's a lot of new, systems now. Like I mentioned, Rogueless. Petzl makes a lot of fantastic equipment. I'm sort of dating myself here a little bit. 25 years ago, we used to work with, figure eights and brake bars. Now there's a lot more sort of clutch systems and automatic systems that are much easier on the equipment, not so much shock loading, and much easier on the patient as well. And again, all that equipment, needs to be managed by the rescue team. It needs to be certified. That's when you'd have a sort of a rescue team. So those are people that would typically, if we were providing that service, we would typically be on site. We participate in the work, so we sign on to the permit as the rescue team. Usually there's a toolbox talk that involves everybody, including the rescue team. So you shouldn't, I guess you shouldn't see 2 guys sitting in a pickup truck, like, waving at you, telling that you're the rescue team. They are part of the whole work planning process. So when we do these jobs, you size up the job, you get your equipment ready, you set it up, you have a toolbox talk. What we often refer to as last minute risk assessments where, is everybody good? And then we do it, and the rescue team is part of that, and again, it wouldn't be unusual. You could have a rescue team, responsible for 5 or 6 different working at heights, activities going on at any one time. So sometimes it's just one quick job. Sometimes there's 5 or 6, permits out and people are working in one rescue team would suffice for all. It's just the fact they're on site, they're part of the work planning process, and they understand what's happening makes it much easier. You can imagine a fire department arriving at a scene of anything, and suddenly you're at the gates of an unfamiliar plant. You're not sure how things work. The best people to do rescue, are the people that work in the area, that work in that plant. So if you're Michelin tires, your Michelin workers, your Michelin rescue team understands that plant inside out. Whereas, the fire department showing up, is trying to get a briefing and trying to figure out what's going on, but it's new to them, whether it's Olin's Breweries that you've been called to a tank as the workers in there, or whether you're called to a shipbuilding or what have you. So yeah, it can be challenging for local fire departments. Best people to do it are the guys that are right on site. And again, you'd have those people part of the whole work process.
Now, one point I want to make to our listeners today is that, I've been in the business for 30 some years, and equipment has changed so much during that time. You mentioned the kind of equipment that's needed to do a good rescue. And look, nowadays compared to 30 years ago, there is so much equipment available. There are so many different sources of equipment. Equipment is designed for specific situations. Folks need to ensure that, when they have to do that high rescue work or just any kind of rescue work, make sure you get the right equipment for your particular situation. Take some time and shop around. Now,
Yeah, and
go ahead.
I just sense things, the things that too is things change a little bit. You and I probably remember when there was, two manufacturers. I think Surdy was one, and DBI Sala was the other. I always remember there was a fellow that used to come around to the safety shows, and he would drop a dummy on a shock absorbing lanyard just to show how they all worked. And for a long time, shock absorbing lanyards were the industry standard. And if you recall in the training, we talk about estimating fall distance and how long when the thing comes out. The trend now is really towards self-retracting lifelines. And self-retracting lifelines, what's great about those is they operate like your car seatbelt at 4 feet per second. They lock up. So you're not getting these workers sort of taking a 15-foot fall and being at the end of a shock absorbing lanyard. A lot of times now guys will fall and they fall about a foot and the thing grabs them and they basically get back on and climb up. So, equipment's improving. Harnesses are way better than they used to be. They were really just nylon straps back in the days. I recall now they've got padding and, you can get straps for women and, harnesses for women and stuff. So the equipment is really improved. But yeah, we're seeing a trend, less shock absorbing lanyards, more self-retracting lifelines.
So the second topic I want to talk about, confined spaces and confined space rescue. Again, unfortunately, a lot of organizations I've met do not have any kind of confined space rescue plan. They throw people into those kind of situations and almost in anticipation, well, nothing's going to happen. Well, things do happen. Yeah. So talk to us about what you would recommend to a company when it comes to confined space work.
Same kind of thing. So, start off with, leadership. A lot of companies will sort of focus on the workers. We got to get our workers trained up in confined space. But we always say, look, if you've got supervisors, they should be taking the same course. Because an old professor of mine used to say, nothing is obvious to the uninformed. They, once a supervisor understands the risks in confined space, and some of the ways that those are controlled and that sort of thing, then it makes it much easier to get not only, it's a big deal. Like you have to have equipment, you have to have training, you have to have what we call administrative controls. So again, permits to enter confined spaces, task assessments, task hazard assessments. So what are we doing, and the concept of last minute risk assessment. So what are we doing today? What's the weather like? Is this job outside or inside? Is it hot work? We used to say there's 4 things you can do in a confined space. You can inspect things. You can clean things. If you clean things now, you've got materials, so you need safety data sheets. You can do hot work and repair, which is now introducing explosive gases and one of the trends recently, folks, for example, know that there's a movement now to measure what they call VOCs, volatile organic compounds, with what is called a PID or an FID sensor. The old explosion sensors, the upper and the lower explosive limit, those are great for explosive dangers, but they actually go right past the toxicity of some of these explosive compounds. So that's something that you would, if you weren't taking training, you wouldn't know that there's PID or FID sensors on the gas detectors. You've got to have equipment, and that equipment has to be managed. Same thing goes with, harnesses. There's a lot of similarities between the equipment that you buy. Full body harnesses that are used for fall protection are also used for confined space entry. But those things have to be inspected by a third party, and you can't just buy gear and throw it in the corner. Just recently, sort of on a slightly off topic, but there was just recently a Transportation Safety Board investigation into a worker that was killed in Newfoundland. He was on a boat and he fell into the water. His life jacket did not inflate, but in the finding they said it also wasn't serviced. So, you can't just buy equipment and not service it. It has to be inspected and make sure it's fit for purpose. And within that, then you start to look at the type of work that you do. So probably the easiest way to do rescue for confined space entry is that vertical top-down entry. The worker that's going into a manhole or into some sort of top entry from a tank. You can set up a tripod or an arm, a davit arm. You can have a self-retracting lifeline. You can have a lifting system. So if the worker does get into trouble, you just crank on the winch and you pull them out. So we call these non-entry rescues. And so if the job it lends itself to that, then by all means. And we've all seen city workers, municipal water workers, that kind of thing entering from the top. So that's called a non-entry rescue. So that's your sort of basic. Now, if you're doing sort of horizontal entries, entries into very difficult spaces, shipbuilding is probably one of the worst for this, but things like even, entering boilers, places where you simply can't pull the worker out, you've now got to have a team to go inside and rescue the worker. That's going to involve it's not just a question of crawling into a space and grabbing a guy. They've got to be packaged up. So that worker might have to be moved from in between baffles or in between different obstructions inside the confined space. They have to be manipulated. So you need workers that know how to do that. The workers probably should go in under breathing air, themselves, and they might have breathing air for the victim. They have to package that person up into a piece of equipment like a sked or a spec harness or something like that, a smaller system, and then they have to be removed. And it could, there can be aspects of even fall protection within a confined space. Sometimes you're in a giant tank and you've got a scaffolding set up and you're actually working at height in a confined space. So again, the rescue team has to be aware of that. The rescue team might have to go in, and the first part of the rescue might be get the guy off the scaffolding, or rescue him from the height, and then get him out of the confined space. So you need that development. And if the tripod piece is simple because that's a piece of equipment you can buy and your workers can be trained in it. And most confined space safety programs, what we would call entrant attendant, cover that aspect of it, which is, okay, non-entry rescue. Here's, call for help first of all, and 911 may be part of that because you probably will have a medical issue by the time the person gets out. Let people know at the site that you get help. Maybe blow some air in if you have a ventilator fan, blow some air down into the worker, see if that wakes them up. And then just get working on the rescue right away. The critical thing we always tell the attendants is don't go in the space. I've got a video clip a guy sent me here from Malaysia. It shows a worker. It's terrible. It shows a worker going into a space, takes off his hat, he climbs. About 30 seconds later, he comes out gasping for air and collapses and falls down. Two guys walk by. About 10 seconds later, in they go. And it's not people. It's just a human, urge to do that. People have been killed in jumping into rivers to try to, rescue kids. And it's just what we do is we see somebody in trouble and we want to go. But you've got to have that discipline to procedure, which is do not enter the space. You've got to stay outside. The rescue team will need information from you. They'll be definitely part of the rescue team to recover, and you can't have that worker enter that space. So we really push on that in the training. And then again, now you're into a rescue team. And like I said, rescue can be 2 or 3 guys. It can be right up to a team of 10 people with communications and all that stuff. So there's a number of it really just depends on the sophistication. Like I said, probably the most challenging environment for confined space rescue is shipbuilding. Just by the nature of the way they construct tanks and in between hulls and all this, it can be very, very challenging, setup. So all the more reason to make it safe. To be very clear on what the job is and to remove workers. I always tell guys, if you're starting to feel funny in there or something's going wrong or you don't feel right, get out. Start moving now and get out before you turn into a casualty.
Now, when it comes to confined space, I've had people say to me, well, look, I sent my workers on a classroom course for half a day, 2 days, whatever. And I always say that's a great starting point. But if you're really going to train your people in confined space and you're serious about the issue, you need to have real life practical training for them where they get the chance to actually do simulations where they go into confined spaces, where they can actually get used to being in a confined space because it's not for everyone, where you can practice your rescues and so on. Now, do you folks provide that type of real hands-on experience?
Yeah, absolutely. And I mean, most training companies will try to provide some sort of simulated confined space environment. Even companies themselves will put them on or build them just so their teams can practice. And it can be something as simple as a couple of old tanks. Usually we talk about top-down entries, so vertical entries, horizontal entries. You can play around with the size of the hole. There's some places that are very, very tiny to get into. I remember, years ago when we were doing a lot of pulp and paper mills, probably the most evil place for a worker to end up is something called a dryer can. Where you had to get into this little, it was the tiniest opening that you could possibly imagine a worker being able to get into. And, although it was considered, this is a tough job, over time, people started altering that job a bit so it became much easier to get people in. And the other thing that also, Pearlie, is that engineering wise, a lot of these old plants, used to be pretty tough places for confined spaces, stock chests and the pulp and paper mill and all these things were newer engineered spaces now. We see it a lot on new ships, tend to be, designed and engineered with a little bit toward the fact that people may have to enter these confined spaces to do work, and it makes it a little easier for them to get in and get out. Of that, and access holes are a little bit better, but you absolutely need to practice. Your rescue team needs to go in and take somebody, not a 25 pound dummy, but a 150, 200 pound. We used to do live rescue in the old days. I was often the victim that I'd go in and lift out take a real person out. And there's value to that. Obviously, using training dummies is good, but actually letting people know how you can move people out is good as well. And you can get really good training outcomes from that. But for sure, you've got to have some sort of simulator to go in. A lot of places will say, let's just go into one of our regular confined spaces. Well, confined space, so we have to permit it up and gas test it and all that. But by the same token, an internal team can do that. They can, have a space that perhaps is decommissioned or is not active as part of the operations of the plant, and go and practice in their real area and pick different spots, pick different types of practice to do. There's the saying that the guy doesn't have 10 years experience, he has 1 year's experience 10 times. So picking different spots in your plant to do a confined space is good. Probably the folks that have the toughest time on this, I think, Pearlie, are the small service companies, 2 or 3 workers, that enter confined spaces. So the only time they're probably going to get in to do any kind of training like that is if they're on a training program. Those are the ones that are a little bit more challenging. But if you're a workforce, if you're an operation that has 500 or 1,000 people working there, then you can probably develop your own team and have that. We used to ask folks in the old days on rescue team, were you volunteered or voluntold? If you get just an example, they're no longer even a company, but we used to do a lot of work in Liverpool, Nova Scotia for a group called Bowater Mersey. And Bowater Mersey had a really good rescue team. There was a waiting list, and they practiced and they had a bit of swagger, and they got, they had a bit of, they had jackets and stuff, but they had real pride in what they were able to do, and they were really good. We used to go down and train them, and man, we used to, every year we'd say, we got to go back to Bowater. We got to come up with some new things for these guys because they're hungry for more stuff. That's what you want. You want a team that people want to get on it, and they're practicing, and there's, that's what you're ideally looking for in a big plant, like that. And it's possible. I mean, Michelin's well known for their rescue teams. I mean, Irving's got a really good rescue team there, and you get, like I said, waiting lists are what you want, guys to get on there because they're keen and they practice and they do their things. And so you may never go to a real rescue. And then one day, kabang, the call comes and it's showtime. So yeah,
Now, to go back to one thing you just said a moment ago, and I think it's important to emphasize, is that, sometimes people think of the pulp mills, the large industrial type sites, but you mentioned there's a lot of 2-person, 3-person operations, a lot of small mom and pop shops that do work in confined space as well. Whether it's municipalities, you name it. Can you identify some of the smaller clients, the type of work that they do that maybe have contacted you over the years and said, look, we didn't, in a lot of cases, they didn't even realize they were working in confined spaces.
Yeah, a lot of these folks they're subcontractors. So often, there'll be, mechanical or plumbing or electrical or whatever it is they're doing. It's not unusual on large projects, let's say a refit of a Coast Guard vessel, to have 5 or 6 smaller, contractors on there. The spar marine guys might show up and they might be rigging up wires to the mast. And so they're working at height. You've got, workers from, like welders and fabricators that are inside a confined space. doing work in there. So yeah, there's a lot of those smaller ones. They get their folks trained. And then it's really just a question of figuring out how they integrate. You might show up and be, a small mom and pop and just, you can say, look, we have our own permits, but, if you want us, we can sign on to your permit. So sometimes if you're doing a job at a big company, like say Irving might say, no, we want you on our permit. Show us your training. And again, that's another thing I'd remind, viewers, there's not just a question of, yeah, my guys are trained. It's okay, great. Show me their cards. Prove to me that they're trained right now here today. And that, people are getting used to it. A lot of guys carry their certs on their phone. But that's part of it is you come in on our permit. The other piece that a small, so some of these smaller companies will say, well, we can't be expected to know all of the new things that are going on in confined space, or I can't be expected to have my guys trained or whatever. That's not the way it works anymore. There used to be an old, legal tactic called the country doctor defense, where it would say, look, I'm, Comeau, mechanical here in Pugwash. I can't be expected to know everything that those big guys in the CEO. That's not, you known or ought to have known. That's the phrase that the judges are saying. And so, in terms of infrastructure, we get it that sometimes it's tough for smaller, operators to come up with permit systems and all this stuff. So we always say, we use permits. We have generic permits on our course that we get you to fill out, task hazard assessments. We show you rescue plans. And we always tell the workers, go ahead and take these back to your company. Like, there's no proprietary information here. We have a nice work permit here. It's nice and generic. Alter it if you want. We have a rescue plan. Here's how we do ours. Take that home and fill it out for yourself. Put your logo on the top. We're wide open on that stuff. Like, in terms of use our, you have to write your own procedures, obviously, for your own work, your own safe work practices. But in terms of being able to integrate, your workers, so that going back to that small mom and pop, those two workers should show up. They should be trained. They should have their equipment. It should be, their gas detectors should be bump tested. If they're going to wear monitors, that everything's up to date. Their harnesses are all good. They've got proof of training. They've got, a confined space permit and a rescue plan if they have to write their own. Sometimes the workers will say, we're doing this job and we need two rescue standby guys for this job. So we'll show up and be there as part of the rescue team and help them permit up. We use our permits. That it is somewhat daunting in the sense that if you don't know anything about confined space or the program, it can seem like a huge sort of hill to climb. But once you sit in on a course and they say, okay, look, folks, here's the hazards of confined space, right? Here's how we control these hazards. Here's how we control the work in a confined space. It's a permit to work. It's a specialized confined space permit. So it goes through all the different dangers that can be there. Is it a hot work permits? It's authorized by everybody, signs off. The isolation, some isolations, you might be a contract worker coming in to do work on a machine, and it can be a 35-step isolation process. So that worker needs to know, where do I fit into that? Well, where I fit in is I'm the entrant. I'm the person in the space, so I get to test the equipment before it goes. I sign off on that isolation certificate. Like I always say, the entrant's the one with the most to lose. So, that's all part and parcel of those procedures. And the workers have to be aware of that. That's the other great part about training, is it allows you to ask the right questions. Hey, can I see the isolation certificate for this thing? Oh yeah, sure. Here you go. Okay, great. Where's the start button?
Yeah.
Boom, 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 and give it a push. And then I'm comfortable. I can go in there and not get chopped to death by what we used to call the whirling blades of death, or, whatever other horror is inside that confined space. It's controlled now, and the work is being done safely.
Look, we could talk about these two topics all day. I mean, there's just so much to them. But maybe to finish off our podcast, David, do you have a couple of examples of situations that you've encountered over the years that maybe you could share with us? Maybe an example of working at heights rescue that happened that you became aware of, and same thing in confined space, maybe a rescue that you've become aware of over the years of a company, a situation they went into, and what happened?
We've, over time, we've had a couple workers usually come back to us and tell us, hey, I use this. Before, we've had, some guys that were brought out of a mobile elevated work platform, the MOOPs. That's a sort of a new, relatively new piece of kit in industry. They had a worker that had a heart attack, in there and just sort of sat down and couldn't be moved, and they actually rigged him up and got him over over to help. The platform, he wasn't on an elevated platform. He had just come off onto something else. So they were basically moved him down there and lowered him down. It worked pretty successfully. Confined space wise, there's been there's not a whole bunch of examples other than sort of things where, the situation was getting a little wild. We were on a job once for, Emera, for Nova Scotia Power. And we had a worker in an area, a space that was quite unique. It had a potential water hazard. So we had the water isolated, in the pipe, with a couple of barriers, and then it was actually a turbine that he was in. So we also had to isolate, the blades. We were doing the work, without respiratory protection, but with ventilation. And because it was hot work, he was creating quite a bit of carbon monoxide. And at one point, we got him over the limit. The good news was everything was being monitored, so we stopped the work right away, got him out of the space. There was a little investigation, into how it all happened. And then we decided to change the work and move to, basically a breathing apparatus with a welding mask, on a SCBA. Not too common out here, but very common out in Alberta. We contacted some of our colleagues out there, and they sent us a breathing apparatus mask that had a welding thing attached to it, and went on to the work right there. One of the things I always say about confined space is that sometimes it's not the space. It's not a hazard in the space. It's just the fellow has a heart attack or trips and falls and injures themselves, and they're just immobilized and they need help coming out. So, what we always say to the rescue teams, once you've ascertained that the area is safe, if there's no atmospheric hazard, then you don't need to use atmospheric protection. If there's no respiratory protection, if there's no physical hazard, if it's just the guy slipped and fell and he's taken out his back in a confined space, you can just go in and get him. So those are usually the examples. There haven't been, thankfully these things don't happen very often, in terms of needing a rescue. And because of that, there's not a whole lot of examples I can kind of pull to. Most of them have been sort of tragedies that have occurred, and then we're sort of brought in after that to kind of, everyone gets much more safe after somebody gets injured or killed. But yeah, most of them have just been sort of close, again, safety. This is what we're looking for, is by the time the situation gets bad or turns to, IDLH, they're able to pull the worker out, and it's a good news story.
Yeah, and a key point I think I want to remind our listeners of is the fact that, when you hear David talk, he's talking about organizations that generally probably you've worked with that have a good safety record, a good safety program. They put all the things in place. Unfortunately, we continue to hear of situations where companies had nothing in place. Yeah. And those are the ones you read about in the media, where some worker has died in a confined space or someone has died trying to rescue. Again, just to finish off our podcast, when I worked at WorkSafe, when it came to confined space and fall protection, I should say, these are areas they call zero tolerance. The bottom line is if you get a mistake or something goes wrong in these two situations, unfortunately, more often than not, if you don't have all the right things in place, it's going to end up in a fatality. It's going to end up in a worst case scenario. So, for companies like yours, David, keep up doing the good work that you're doing, educating people. That's really what a lot of it's all about, is educating, training, making sure companies do know what they should have in place to keep their people safe. Yeah, thank you very much. Thank you very much, David, for joining us today. As I said, these are complex topics. Make sure that you reach out to the professionals like David and WorkSafe here in our province. Also have a lot of professionals on staff, occupational hygienists and other staff that can help you, that can give you the information you need to work safely. Thank you very much, folks. Glad you listened to us today, and we'll see you next week.